So let's just talk about some of the basics of treatment associated with just the general most common scenarios you see in the office.
So the most common reason for infertility is unexplained infertility. So, if you've been trying for 6 to 12 months, depending on your age, and you've had the whole workup done and everything is normal, the sperm is normal, the tubes are normal, you have a normal reserve, everything's fine, then you're kind of put in this category of unexplained infertility. And the first step to treatment is doing something called a medicated IUI, so intrauterine insemination. Usually we do this kind of cycle with some kind of oral medication. One of the most common ones is called Clomid, clomiphene citrate. And basically Clomid is a medication that you take for 5 days. So you call your doctor with your period, you come in for a baseline ultrasound to make sure the ovaries look normal and the uterus looks fine, you don't have any cysts or anything like that. You take the Clomid from cycle days 3 through 7, so 5 days. And what Clomid does is it masks your brain from seeing that estrogen that I talked about earlier. So it makes your brain work even harder to grow an egg. It makes your brain make more of that FSH, that follicle stimulating hormone, that tells the ovary to grow an egg, with the thinking of, if I have more than one egg growing, so let's say 2 eggs or 3 eggs, I'm going to increase my chances of pregnancy. So you take it for 5 days, and then we monitor you with ultrasound and blood work. We bring you back about a week later. We do an ultrasound, and we can actually measure the follicles, right? Those sacs of fluid that house eggs. And we know that when a follicle gets to be a certain size, the egg inside should be mature. We trigger the ovulation, and we schedule an insemination of sperm, which means we take the sperm sample, we wash it, we concentrate the most motile sperm, put it in a catheter, and we put in a speculum and put it through the cervix into the uterus. It's about a 5-minute procedure. It's non-invasive. It happens in the office. And then you rest for 10 minutes afterwards, and then you go along your way. Now, in our unexplained infertility patients, let's say you've done that 3 times. You have to give it a chance. Every cycle that you do that, you have about a 10% chance of pregnancy, which sounds totally abysmal, but you have to put it in the context of unexplained infertility. And those patients with a diagnosis of unexplained infertility now have about a 3% chance per month of achieving a pregnancy. So you're taking it from 3% to 10%. So humans are just really inefficient at reproduction. And so every little bit gets you back to that, baseline that you should be at in nature, which is about 10 to 15%, depending on your age. So that's a Clomid IUI or a medicated IUI. Let's say you do it 3 times and you're not successful. You sit down with your doctor, we go over how the cycles went, and then that's a discussion point of, okay, do we want to keep doing the IUIs, or do we want to get more aggressive with something like IVF?
It's the one disease or category of diseases that a woman may have to pay for out of pocket in a lot of circumstances, because it's not legislatively required for the insurance companies to cover it. And just the weight of that, just even saying that, sounds ridiculous to me.
About 70% of my patients are covered. If you're not covered, there's also more and more options for you out there now. So there's a lot of grants now that are out there. So there's a grant that's growing. It's called Baby Quest. There's the Tanea Cade Foundation. You just have to be hooked into the right avenues to learn more about them. SGF, Shady Grove Fertility, as an organization, finances are obviously we take it very seriously for our patients, and we have discount programs called shared help where, depending on income levels, you're eligible for up to a 60% discount on your services. We have military discounts. We have, something called shared risk, which is a program that's kind of our guarantee program for IVF or for donor egg, where if you qualify, you're basically guaranteed to take a baby home. And if you stop anywhere along in the process, you get all of your money back, which makes it a lot more palatable. Yeah, so it's unique, but I think you're going to see that, more and more. And hopefully you'll see coverage more and more.
Let's get back into the subject matter. You mentioned IVF. So What does IVF even stand for?
So IVF is in vitro fertilization. It just means that you're fertilizing an egg and a sperm outside of the body.
So what would make you want to offer somebody IVF?
Many different cases, right? Every case is individual. Let's say a patient is 30 years old and she has a good ovarian reserve, everything's totally normal, and she's tried 3 IUIs and they failed, I would be more comfortable telling her, you know, your success rate's not going to change with IVF, even if you do 3 more IUIs and you wait a few months to do IVF. Whereas my 38-year-old, I would be a little more inclined to kind of, after trial of 3 IUIs, move into the IVF category, especially if they wanted more than one child. I'm always thinking about the second baby. If they get pregnant tomorrow at 38 with the first baby and they require IVF for the second baby, now they're going to be 40 when they come back, and their success rate is going to be even lower. So one of the biggest pluses of IVF is fertility preservation. Is if at 38 you can put 2 embryos in the freezer, if you use that embryo at 39 or 40 or 42, you're going to have the same success rate as the 38-year-old. So those are all the things I look at age, I look at reserve, and I talk to them about what's going to complete you as a family. How many children do you want? Are you going to be happy with one? Do you really, really want 2 or 3? So that's important. So that's for unexplained. Other factors are tubal factor, right? If both of your fallopian tubes are blocked or damaged, then it's almost impossible for you to get pregnant without IVF, because IVF allows us to create an embryo outside of the body and then bypass the tubes and put it directly into the uterus. So tubal factor infertility. Severe malfactor infertility, meaning if your partner has a very, very low sperm count, those patients also benefit from IVF because we have the option of using something called ICSI for fertilization, where we take one sperm and inject it into the egg. So you don't need millions of sperm. You only need as many sperm as you have eggs.